My name is Santiago Bautista, and I'm a student in the University of Phoenix. I'm in the program of MSN Admin, and I have a assignment, a project in NUR 443 under Professor Hector Vizoso. My, my project is about the presentation, research, article, critic, and the topic that I would gonna present is about the disparities in pain management between cognitively intact and cognitively impaired nursing home residents. This was authored or researched by Kimberly S. Reynolds, Laura C. Hansen, Robert DeVellis, Martha Henderson, Karen E. Stenhauser. And to start this presentation, I would like to point out the characteristic of the study. It's first the population. The population is adult residents in North Carolina nursing homes. And the intervention is about pain management. Comparative population, residents with no mild, moderate, and severe cognitive impairment. Methods: retrospective study through charts abstraction. To give you the background, or to give understanding about the research, I would like to read the abstract. This study tests the association between residents, cognitive impairment, and nursing homes pain management practices. We use charts. According to the author, they use charts abstraction to collect data of 551 adults in 6 North Carolina nursing homes. From the standard data collected in the minimum data set, or MDS, 24% of residents experienced pain in the preceding week. Reports of pain decrease as cognitive abilities decline. Nurses completing the minimum data set reported pain prevalence of 34%, 31%, 24%, and 10% respectively for residents with no, mild, moderate, and severe cognitive impairment. Demonstrating a dose response type result. 80% of cognitively intact residents receive pain medication compared to 50% of residents with severe impairment. Cognitively impaired residents had fewer orders for scheduled pain medication than did their less cognitively impaired peers. Yet, the presence of diagnosis likely to cause pain did not vary based on residents' cognitive status. So the authors conclude that pain is under-recognized in nursing home residents with cognitive impairments, and that cognitively impaired residents often have orders for as needed analgesics when scheduled medication would be more appropriate. To continue this presentation, I would like to emphasize about pain. According to the medical news today, in medicine, pain relates to sensation that hurts. If you feel pain, it hurts. You feel discomfort, distress, and perhaps agony, depending on the severity of it. Pain can be steady and constant, in which case it may be an ache. It might be a throbbing pain, a pulsating pain. The pain could be a pinching sensation or stabbing one. And there are types of pain: acute pain, chronic pain, and classification. It's classified as nociceptive pain, which has two parts, somatic and visceral. Also, there's a non-nociceptic, which is the neuropathic. The nociceptive pain, specific pain receptors are stimulated. This receptor sends temperature, vibration, stretch, and chemicals released from the damaged cells. So this kind of pain might be experienced by the cognitive impaired resident, but it cannot be recognized because of their impairments. So I will show you. I got this from the mydoctor.com. It's about the how you feel pain and the pathways. First, the pain receptors in the skin are activated by tissue damage. Then a signal travels up to the peripherals, as you see in the picture there. Signal travels up to the peripheral nerve. So this is the pain here, and it will go to peripheral nerves. And then when the spinal cord receives the chemicals or the neurotransmitter are released, this activates other nerves that pass signals to the brain, and then the thalamus relays the signals on the somatosensory cortex, or the sensation, or the frontal cortex, our thinking, or limbic system, the emotional response. So I will also emphasize here the difference between cognitive and with the impairment. What do you mean by cognition? Cognition is a term referring to the mental process involved in gaining knowledge and comprehensions. This process includes thinking, knowing, remembering, judging, and problem solving. So if you just think that this process will be impaired, so this could not be recognized anymore by our residents in a nursing home. According to psychology.about.com, cognitive impairment occurs when problems with thought process occur. It can include loss of higher reasoning, forgetfulness, learning disabilities, concentration difficulties, decreased intelligence, and other reduction in mental function. Cognitive impairment may be present at birth or can occur at any point in a person's lifespan. So there's not only, for the impairment, it's not only relates the adult population, but also it affects our small or our young, or even the children. So this studies, the disparities, this is a quantitative study that I selected for this presentation. So to continue my my topic about the disparities of cognitive and between cognitive and cognitive impairment. The studies quality or the strength of the study in my analysis. Research question clearly stated at the introduction of the paper, does the nursing home staff currently meet the core principles of high quality palliative care, adequate pain management? The protocol was reviewed and approved. That's the strength of the study by Institutional Review Board or the IRB. The design of the study is sensible use of charge abstraction for method, since the population involved are vulnerable population. There are residents in a nursing home. And the weakness of this study I have hard time to move this up, is the adequate pain management among elderly in nursing home needs actual objective observation and should not rely on what was written in the chart, because the study or the research was only they collect the data through the use of MDS. They didn't not really actually observe the residents or observe the staff on how they assess the elderly or the residents in the nursing home. And also the investigators did not clearly define the population. Cognitive impairments. The judgment of cognitively impaired person is not dependable in this study. There was an assumption that notes on the doctors were accurate and reliable. A neurologist or psychiatrist should have been employed to confirm the degree of cognitive impairment of each participant for validation of purpose, because these are the specialists that will examine the level of impairment of these residents in the nursing home. And to move on, the methodological limitation of this study. This study being a retrospective cross-sectional survey testing the association between residents' cognitive impairment and pain management practices is ethically acceptable because the sample population is considered a vulnerable one. Retrospective means a study look backwards and examines exposure to suspected risk of protection factors in relation to an outcome that is established at the start of the study. That's what it means by retrospective. Second, methodological limitation of the study. The random sampling of charts is ideal, but the authors did not discuss the details on how this sampling was done. And third, as mentioned by the authors, the result cannot generalizable since the study included only the nursing homes in North Carolina, although there was variety in terms of nursing homes like private or public. So they just concentrate on the certain nursing home. And the researchers' biases, researchers did not pay attention to the wide range of ages of the residents. They didn't say specific, they just say elderly or adult residents in the nursing home. They didn't put any specific age of the patient. And that was not been defined. And I have a problem. These things and then the ethical and legal consideration related to the protection of human subjects. This is other questions that part of my presentation. This is how we critique the research. It's ethical, or it is ethical and legal consideration related to the protection of human subject. The study used secondary data, and thus there was no ethical issue regarding informed consent of the participants. They don't need to ask for that. The investigators did not state in the paper that they will protect the participants' confidential data, and if ever they did this, they did not mention how they protected the confidential information of the participants. But the authors mentioned that the University of North Carolina School of Medicine Institutional Review Board reviewed and approved the study. And relationship between the theory, practice, and research. This study was confirmatory study on previous papers mentioned in the bibliography and review of literature. It was in the research study. The authors were consistent in relating the theory of pain, symptoms, expression in the elderly population with or without cognitive impairment, and adequacy of pain management, and its ethical and legal application in nursing practice. The nurse roles in implementation and dissemination of the result. The nurse should educate the nursing home staff on how to pick up subtle signs of pain among the residents. The result of this study should be included in the education of this staff. When the physician visits the residents, the nursing home staff should inform the doctors of their objective observation regarding the possible pain and frequency of reports of pain of the residents, so that pain management would be on regular basis and not on PRN basis. And with regards how the study provides evidence for evidence-based practice. This study is another evidence confirming the idea, possibility that the residents' pain management in nursing home is inadequate. The results should be disseminated in all nursing homes across the U.S. to create awareness of the phenomenon of pain among cognitively impaired elderly residents. And this, because this was a quantitative research article critic. This is a quantitative research, so I have this the critics includes the comprehension, um, comparison analysis, and evaluation. And in my understanding, with regards to the comparison, the study was conducted to test the association between the residents cognitively impaired and pain management on 551 adults in 6 North Carolina nursing homes. The method used retrospective study through chart abstraction. The research question clearly stated, does the nursing home staff currently meet the core principles of high-quality palliative care adequately pain management? The theory of etiology of pain and clinical presentation of pain was adequately addressed. The researchers conclude that pain is under-recognized in nursing home residents with cognitive impairment, and that cognitively impaired residents often have orders for as-needed analgesics when scheduled medication would be more appropriate. This is according to Reynolds, which is the authors, and the group. And my comparison and analysis, the design of the study is sensible use of chart abstraction since the population involved vulnerable population, and the use of qualified, trained chart abstractors with medical background. But the retrospective cross-sectional study, the minimum dataset, may not contain uniform information needed for analysis, and it is difficult to recall or find the missed data. Adequate sample size of 551 residents groups are deemed comparable because they were all elderly in a nursing home, except that the random sampling of chart was not described in details. For my evaluation, the researchers conclude that pain is under-recognized in nursing home residents with cognitive impairment, and that cognitively impaired residents often have orders for as needed when scheduled medication would be more appropriate. That was according to the authors, Kimberly Reynolds and the group. As mentioned by the authors, the result cannot be generalized since the study included only the nursing homes in North Carolina, although there was variety in terms of types of nursing home, like private or public. And the finding has potential to use in nursing practice to educate the nursing staff on how to pick up subtle signs of pain along the residents, and updating the precision of the current observations and findings of residents to day-to-day pain management status. So that's all my presentation, and thank you very much for everyone for viewing my presentation. Thank you.